The COVID-19 pandemic has forced industries across the spectrum to quickly alter their business models, which meant that the need for accelerated digital transformations was higher than ever before. The healthcare industry was no exception, but how we access medical care has been undergoing a transformation for years thanks to the evolution of telehealth. Heather Cox is the Chief Digital Health and Analytics Officer at Humana, and on this episode of IT Visionaries, she touches on how healthcare providers across the industry have adapted to an altered landscape, and she dives into the benefits telehealth is providing patients in the midst of a pandemic. Enjoy this episode. IT Visionaries is created by the team at mission.org and brought to you by the Salesforce Customer 360 platform, the #1 cloud platform for digital transformation of every experience. Build connected experience, empower every employee, and deliver continuous innovation with the customer at the center of everything you do. Learn more at salesforce.com/platform. This podcast is created by the team at mission.org.
Welcome to another episode of IT Visionaries. I'm Ian Faison, host of IT Visionaries, and today we have special guest on the line. Heather, how are you?
I'm great. Thanks, Ian. I appreciate the invitation to join you.
Yeah, we are excited to have you. We're going to talk all about Humana and the cool stuff that you're doing there and your background in technology. So let's get into it. How did you get started in technology?
Let's go all the way back. And I will just start with, I'm neither an engineer by education or trade, nor am I a data scientist by education or trade, but I became a customer fanatic in the early 2000s during my years at E-Trade. And I became that person, I was managing all the operations and trouble would hit. I would have to go solve it because we were in the midst of, if you can remember, back in the early 2000s, of us trying to disrupt Wall Street with our new model of all online. And it wasn't even called digital back then. It was World Wide Web and fax and phone as alternate delivery. And, to getting people confident enough to trust you with their money when they're sending it in by mail at the time, or you could only engage with your banker or your broker by phone. It was really critical that we do our best to obsess about experience on the web. And it was a way for us to reduce our costs as well. A phone call would cost several dollars, an interaction on the web, fractions of a penny. And so when things would go wrong, I'd have to go knocking on people's door to figure out what happened, why. And often that was my IT colleagues. And so I became, just dangerous enough to be, just knowledgeable enough to be dangerous. How about that?
Yeah, isn't that, you kind of have one road or the other. It's like the accidental technologist or the technologist who now is entrenched in business. But either way, this new role, this head of technology role, this chief technology role now has to have both sides, right? You have to be fluent in technology and you have to be fluent in business. I'm curious, how do you think about the business?
Yeah, I would call myself really a business technologist, right? I have to deeply understand what it is that we're trying to do to create value for what we call at Humana our members, and as well as our providers and the care teams who take care of our members, making sure I'm partnering with the line of business leaders to drive their agenda, but to also press the limits of what that agenda can look like, and so that we're actually driving a digital transformation at the same time that we're achieving real-time business value. So it's a matter of making sure I understand enough about the business to help them deliver in the short run, at the same time really pushing the limits to ensure we're actually advancing transformation overall. Otherwise, if we don't drive the transformation to live in this new world where it's technology enabled and our members not only have rising expectations, they have completely changing behaviors, including in healthcare. And would love to talk to you a little bit about what we're seeing now that in this COVID world as to new behaviors in healthcare. But we've got to be great at the technology and understanding what the great solutions can and should look like. But we also have to have great empathy for the business. And I would tell you, when I talk to business partners, you have got to have great empathy for technology and what it can do for your business so we can help you rethink the model. So it goes both ways.
Yeah. So what's the scope of your role? Are you working on internal technologies? Are you working on customer-facing technologies? Bit of both?
Yep. I would call it a bit of both. And so let me talk to you a little bit about some of the kind of key areas that we're focused on. And so if you think about our strategy, our overall Humana strategy, it's there are two primary pillars around seamless and easy experiences. And how do we think about those and ripping friction out of process, including as we think about it in the digital space, as well as creating better health outcomes. And so hopefully you're creating easier, seamless experiences that are personalized, contextualized in this new digital world that also deliver improved health. And so our job is to make sure that we are enabling the organization to really go after those strategic pillars. And so when you think about digital health, you talk about things like interoperability, advanced analytics and artificial intelligence. You talk about virtual care, whether that's telehealth or remote monitoring or digital access to behavioral health or digital therapeutics. These are all key things that fall right in our domain. So that's kind of external facing and making sure that we're changing the sets of experiences for our members and the providers who take care of them and the care teams that take care of those members. And then there's a flip side to that. There's driving the advanced analytics agenda here at Humana. Well, that really requires kind of going all the way back to the core of, we've got to have the right kind of platform. In this day and age, it needs to be a public cloud-enabled platform. We have to have the right elements of data governance and the right tools to govern our data. And then we've got to get it certified. And then we've got to create the right security environment in the cloud, port our data into that cloud, create data products across the spectrum of, you have raw data, you have all the way down to fit for purpose products that the business can consume. And then you lay advanced analytics tools on top of that data so that you can create the access patterns to pull data out to get to insights. So we have internal work that we're doing and we have external. But we also have a deep partnership. I want to be very distinct with our IT organization. Our IT organization, we have hundreds of core systems that have to keep this very large payer. Humana is a payer, yes, but also we're a healthcare provider. And pre-COVID, we had 80,000 nurses a day going into people's homes. And so we're one of the largest healthcare providers in the US, and along with our network of clinics that are both owned and we have partnerships and JV alliances with. So this is a really interesting, set of swim lanes that we operate in. And we can operate, we've got a full stack engineering team, analytics teams, product and experience teams. So we can run at a speed that's different than the overall corporation, at the same time partnering very closely with our IT and security colleagues to ensure that we're delivering privacy, security at scale and, production level experiences that can be maintained and sustained.
Yeah, it's an interesting point about speed. Specifically within healthcare, you worked in the financial sector before Humana. I'm curious, also an industry that works at a different speed, but what could healthcare learn from the financial sector and how has that evolved?
Yeah, sure. And I'll just offer, I did spend 25 plus years in financial services, and Humana I joined, and tomorrow is also my work anniversary. And that's 2 years as of tomorrow here at Humana. So I'm new to healthcare, and that has, I think, been a great thing. And it's been a little bit of a hindrance along the way, too. It's been a great thing because let's talk about what you can bring from financial services. What I found is that my skills apply, which is, really relieving after I actually got inside. But, I have a lot to learn as to healthcare itself. And what it allows me to do, though, coming in with fresh eyes, is to say, I've come from a regulated environment where we had very clear rules of the road. We also needed to drive transformation, but it allows me to ask the obvious questions because I'm not so embedded anymore and I don't have the core expertise of the business model. So it's been an interesting combination. But when you think about what we can take from healthcare, there's, if we keep it at a relatively high level, when you listen to your customers, called human-centered design, and you really seek to understand what their needs are and you look to deliver against those needs, good things will happen. You will start to see the changing shift in behavior and things like Net Promoter Score, NPS improve. When you stop optimizing the existing processes and look to prevent those widgets from ever entering the process in the first place, suddenly you're thinking about things in a new way that delivers delight and seamless and easy experience and rips friction out. When you stop saying, I can't do this because of compliance issues. And you start to think about, wow, compliance is really here as a bare minimum rule for what you can do to protect consumers in the end. There's a lot to be said about, wow, you can protect consumers and still delight them at the same time. And I think these are all lessons that financial services has been learning over the last really now close to a decade, maybe not quite as long, and have really been able to really start to rethink their models. And they've also learned to, instead of kind of say the fintech stuff doesn't matter, they've started to bring them in and create new experiences, leveraging all those new capabilities that the fintech sector has been able to start to bring to life. I think that's the next step for us in healthcare. And you're starting to see a lot of it happen where we can partner with health tech companies to really change the game for our consumers. So I think healthcare is a few years behind, but I think this really challenging situation we find ourselves in with COVID-19 has massively accelerated the curve. And you're going to see healthcare in a fundamentally different place as we manage through and get out of this COVID environment.
Yeah, I mean, the acceleration, is something we've talked about with guest after guest on IT Visionaries, that, this digital agenda, this many year roadmap was something that, you kind of maybe had the ear of the CFO. It's like, yeah, okay, we'll get to that in a couple of years, sort of a thing. And now it's just like a race to get a lot of these things. You have to completely reimagine your digital experience for your customers, because when you don't have a physical experience anymore for a lot of them, you have to do that. You worked at USAA, which I've been a member for, a decade plus now. One of the all-time best digital experiences, the application. And a lot of that was due to the fact that they don't have ATMs. They don't have, banks to go to. So it had to be that kind of necessity. What are you seeing with some of those areas in healthcare where, necessity kind of being the mother of invention here?
Yeah. So thank you for even giving the option to go there, because I think we've got some really interesting examples of what's happened just in the last 5.5 months. So specifically telehealth. Telehealth has been around for, before I showed up in healthcare. So let's talk decade plus, 15 years. And people have been talking about telehealth's coming, and telehealth, lots of partners out there that you could go along with, but it just wasn't getting the traction and the volume that we suddenly now see. So let me give some examples. In January and February of 2020, we were at a normal run rate for what we had seen the prior year. And with that run rate, 0.3% of our visits with our providers happened via telehealth. At the height of our COVID volume to telehealth, it got up to 32%. So we went from, let's call it 20,000 calls a month to 1.5 million in a single month. Now we've leveled back out, but we're still at between 12 and 15% of our total volume is coming through telehealth. So our clear opportunity here is to say, wow, we jumped from 0.3% to now a run rate of between 12 and 15. How do we keep that 12 to 15? Because here's what we discovered qualitatively through all of that. Members and private, and Humana, by the way, has a very large share of the market for Medicare Advantage. So we have a lot of seniors in our population. What we found is even seniors were able and willing to do telehealth when it was a time of necessity. They were worried about going to see their doctor in person. They didn't want to be exposed to the virus. That is incredible. Well, doctors have also been part of the challenge overall of getting to telehealth because they wanted people in person. And by the way, reimbursement for things like in Medicare, it was all done differently for telehealth versus in person. Well, suddenly you have doctors doing it and they're finding, wow, for non-acute situations, this is really a great experience. One, we can see the person in their own surroundings. They didn't take the time to take a shower or get dressed up and come in their Sunday best into the office. I get to see that they're living. They didn't know they had animals, so that can contribute to their respiratory issues. Oh, by the way, can you show me the medications you're on? So they can show right there on the video screen what medications they're on, something they might have forgotten when they came in the office. So qualitatively, the visit becomes more powerful. And you can also, there's also a situation where some of our members, they're able to discover they have, they're not able to get to food. They're worried about going to the grocery store. They're not going to restaurants and they don't order food in. So They could then report that back, that social determinant of health, we call it, and then we could help get meals to those members as a result. So the qualitative elements, not only the quantitative, have been really powerful for us. I would call that's one of the big boosts for us. We've introduced AI triage, artificial intelligence driven triage, and where members can go for COVID purposes and understanding and get a quick assessment if they have been exposed potentially and they want to understand what they should do. We can refer them to telehealth, or we can refer them to an in-home test. So we've been able to kind of bridge the digital experience into a physical experience through that in-home test. We've also, and by the way, our testing concierge, 97% of the inquiries have come via digital versus going to the phone, which is a complete flip from what we saw 5 months ago. So those are a couple of examples.
That's incredible. I mean, it's one thing to say, just shifting 1%, from last year to this year, if there wasn't COVID, would have been a monumental shift, but 32% in 1 year. But I mean, it speaks exactly to this idea of customer experience, right? It's like, we didn't know that we could do certain things this way. And now that we can, certain things are going to change, right? Like the idea of like, what does it mean to quote unquote go to the doctor is fundamentally going to change, right? Like,
right.
You can do video calls, you can send photos, you can do all sorts of things now. So like it has to change, and technology is going to be the catalyst for a lot of that.
Yeah. And I think there are a couple of underlying themes there that I'd love to get to. One, we've also had the benefit of our regulator, right, CMS, who allowed us to allow members to utilize even their own devices that, one, to pay for telehealth at the same rate they would at an in-person visit. So the reimbursement rates help kind of break the dam for kind of the entire system. Two, you've got the ability to use your own device to actually access your doctor. It doesn't have to be on some specially placed device, because those were other access to telehealth barriers that were in place before. And then again, the providers also engaging and really leaning in and finding value. So there's a systemic shift here that's happened. Now, what we have to do is take the systemic shift that happened, which was intended to be temporary, and find ways to make it permanent. The good news is, I attended a White House meeting here about 2 weeks ago to really start the conversation around what do we do? And the White House has come out saying, what do we do to make telehealth permanent? So that's a super exciting, right? So not only do we see the behavior shift, we also are starting to see the systemic regulatory shift that will actually help drive this forward, right? Because the quality of care is still there and the reduction of overall costs is there. That's a really powerful combination. And it's just the ease, right? And, especially when you think about people who maybe they don't have a car. So getting to the doctor is physically difficult. Suddenly, we've now opened a whole new access to care, which is just really inspiring. And I do think we've got to also talk about the member experience here and the importance of starting to connect the dots. So what I would say is that what we've got to do in healthcare today is make sure you still have that connection to your primary care physician. So it's not about taking you away from your doctor or creating a separate path or you wouldn't have a primary care physician. It's about taking your primary care and extending the reach of it into your home or to wherever you are, whenever you want it and how you want it, right? So it's a combination of that physical, yes, healthcare as it exists today with your human doctor is really important and that relationship is critical. But how can we extend that care model outside the traditional four walls of institutional care and let you have it in your home, on the go, whether you're on vacation or not? That's the power of what we're talking about here. So it's pretty exciting. So it's not about replacing your primary care physician or what we call the PCP. It's about extending their reach and making that interaction more consistent and sustainable, not once a year, but several times a year.
Well, I think people might not realize how antiquated parts of the system were around telehealth. I think that was part of it. It's like, there's obviously different ways to bill and all sorts of other stuff. But when you have something that, it's literally called telehealth, right? For a telephone.
Yeah, exactly.
Yeah. It's not called Zoom health.
That's why we call it virtual care these days.
Yeah, no.
So we're trying to rebrand it, right? Virtual care.
Well, yeah, no. And so, and in addition to, all of the training that needs to go into staff to figure that out, and obviously like how it gets paid and all of that other stuff. Also, like you mentioned, about having CMS help, accelerate adoption of virtual care capabilities. And then Humana, you all were waiving copays and things like that. There's also that element of the, user trying to figure out how to leverage technology.
Yes.
And how to figure this out. And like, there's a learning curve, right? Like, for anyone who has done a telehealth or, a Zoom, PT session or something like that, like this is a learning curve. If you were used to doing one thing for a long time and then all of a sudden it switches, there's lots of different folks that need that education and training, but it's going to be the new normal and we have to move towards that.
Yeah, I completely agree. And there's also a layer of complexity below it also. Yes, let's assume you have the device and that you have broadband, and so that you can actually access and utilize data and connect. There is still in the 65 plus population a huge divide on those who have access to broadband and those who don't. And the statistics we're seeing is that at this point, the gap is such that there are 9 million 65 plus year olds without access to broadband. So that is a huge gap that we've got to also figure out kind of across industries how we're going to help close, because that gap could create that gap to care, especially if people are prolonged in their ability to get to their primary care physician or their specialist because they're just too worried about exposure. If they have underlying conditions, it's a real risk. And so making sure that we can find ways to bridge that digital divide is going to be a really big, important part of our agenda as a company, but as a country, we've got to really be staring at this. And that's just the seniors.
Yeah, no kidding. So what are the sort of like digital solutions that Humana has been using to help advance care?
Yeah, so we've got, as I talked about, the AI triage capabilities. We've got a health bot that we've implemented where you can go in and ask different questions and get directed to point of care, best point of care for you. We've got that combination of the triage plus in-home testing, and or we can send you, we've got a great relationship with Walmart that allows you to do local store in-person testing. So we've done some really creative, again, our goal is not necessarily to take everything and turn it all digital, but to be, how do you create that seamless physical to digital and digital back to physical set of interactions? And so that's been really important for us. In addition, I just want to talk about something that's a little more, how we built it doesn't really matter, but we created an automated way for us to easily get food deliveries to our members. And why is this important? We were finding, because again, people weren't leaving their homes. They just didn't have access to even basic food. And what we've been able to do in the last few months, we've started making outbound phone calls, right? If we don't have people going to the doctor's office, then we don't have people that have to be staring at things like utilization management or prior authorizations specifically. So we took those people and put them on the phones. These are clinicians to start calling our members and checking in on them to make sure that they were okay, they were staying safe, that they had what they needed, helping them get refills filled and on their prescriptions. And what we've also discovered was a massive shortage of meals. And so we've delivered just under 1 million meals to our members since COVID started. It's something that I think we're very proud of, but we're also trying to figure out how do we sustain helping our members this way so that they start to see that Humana really is there as their partner in health versus just their insurance company. And so that's really the opportunity we have. And some of these new digital tools that are enhancing our humans and doing great work is what's really helping it. And so in that same example, I want to back it up upstream. The reason we were able to target and intervene to the right people and to really focus our energies on those who might have the most chronic conditions and who we thought might be at need is a combination of natural language processing applied to our medical records to find people who have in the past indicated some challenges either with transportation, food, loneliness, things like that, so that we could actually get to them first. And so NLP extracted, and then we could use our machine learning algorithms to actually target the chronic condition cohorts and prioritize who we went after. So we're using technology and in different parts of the process to ensure that we're creating these new sets of experiences, which is pretty exciting.
Well, you said, how it got made. isn't relevant, but on this podcast, boy, it is relevant. Yeah. So how did you make that? And obviously, I love the anecdote about the NLP being used. That's pretty incredible stuff.
Yeah. Let's talk about the NLP. And I'll tell you first what we've been doing for the past. So how do I would describe it? I came 2 years ago, really by the end of that calendar year, 2019, we had kind of our first pass at strategy laid out and bought into by my colleagues. And we were really off to the races. We'd been assembling the different teams from within Humana who would sit in this digital health and analytics organization. So we had great talent that landed in the organization. We also recruited from the outside, and we embarked on kind of a few core elements of our strategy. One, there was the move to the cloud. And so ensuring that we were really getting ready to not only move to the cloud, but move to the public cloud. And two, underlying everything and as a foundation builder, we're going to create a longitudinal human record. So take all of your transactions from the plan and the insurance plan, all your interactions with your primary care physician and your care teams, including external data that you're willing to bring in from the outside to us. And we're going to stitch that together to have this truly horizontal view, call it 360, there's all kinds of marketing terms for it, but that we could actually leverage to serve you and to help your care teams take care of you. So the cloud, LHR, the longitudinal human record, and then all of those enabled by 4 core platforms. 1, a population health platform. I'm happy to talk to you about it. 2, a digital health platform. So we create the population health platform. We start bringing in new sources of data, external sources of data, like your telehealth encounters, your remote monitoring elements. And we start to then create what's the extension of that population health platform into digital health and that platform. We also built a machine learning platform, which is really cool. And we also then created what we call analytics platform as a service. This analytics platform as a service is how we're democratizing data out of the silos. We're a company that's nearly 60 years old. We've grown up through organic growth and acquisition, and we have a lot of data silos. So democratizing that data, moving it to the lake, applying those advanced analytics tools, and specifically, now let's tie it to our basic needs program where we're helping to get food into the homes of our members. We leveraged the Power Platform from Microsoft on top of our data, and we created a very, within a 2-week time, an entire end-to-end system where we automated that program from time of encounter on the phone, placing the order with the third party, getting confirmation of the order, getting it out the door, leveraging that Power Platform. Had we not been on this journey for the last 18 months to 2 years of creating all these foundational elements, we never could have done this at the turn of a dime and COVID. So that's one example. And back to how we built it, it's the power of an incredibly beautiful cloud-enabled data lake with clean data governed well inside with data products built on top of it, as well as then the analytics tools to extract that data and create the insights and create the workflow. How about that?
So I'm with you.
There we go.
It sounds so easy when you say it like that.
Oh, I know. It does, doesn't it?
So what do those teams look like? How are you arranged to handle that?
Yeah. So my organization in digital health and analytics, we've got kind of that product and experience, let's call it layer, that set of expertise, human-centered design, product managers, really kind of understanding deeply what are the customer needs and how do we match customer needs with business value. And then you've got the analytics layer. So we've got our community of data scientists and advanced analytics experts who are there helping to build those tools, those access patterns to the data. And then we have an engineering layer who's there building the infrastructure so that all the other teams, as they're designing products and building the intelligence and, actually instrumenting the experiences with the analytics layer, that we can actually bring it to life and take it to production. But what's really important about my organization, we don't run independently. We don't run, we're not an innovation hub. While we drive a lot of innovation, we're not an innovation team. We're not a lab. We are actually in deep partnership with our line of business colleagues who, so that we can ensure that we're helping them fulfill on their agenda, deliver the value, business value, and at the same time really change the game for how we're driving experiences for our clinicians and our members. So that partnership, we either go in bed with their teams or they come sit with us. And that's how we kind of create that agile working environment across the lines of businesses.
So I'm curious why Humana needs the chief digital health and analytics officer, because this was created for you, right?
Yeah, I wouldn't say it was created for me. I think that's a nice compliment, but it was not created for me. I got the honor of being able to take the chair. And I think we need this right now to create this intense focus on what are the needs and how do we translate that into a digital world. We could solve it in the traditional ways, but we want to rethink the routine and rethink the process and rethink the delivery methodology, all from a customer back view. And here's what I would say about my role. I'm exceptionally proud to have it. It's important. I think our CEO, Bruce Broussard, the management team, who are now my colleagues, were really prescient in how they thought about putting this together, because most traditional companies aren't yet combining digital and analytics together. There's still two very different paths. And quite frankly, when I was in financial services, driving transformation of financial services, we kind of ran them on parallel tracks, but we didn't ever combine them. Well, the fact of the matter is, and the big tech companies have figured this out, as well as the fintech, insurtech, health tech, you name it, tech kind of sectors that have started to crop up, that these two things are inextricable. You have data drives the experience creates more data, and you create a virtuous cycle of understanding and moving toward prediction when you actually combine these things. And so the power of having these two things together is really incredible. That said, I'm here, my team is here, we work with our line of business partners, we're acting as a catalyst to drive to the future. If this role, I would argue, still exists at Humana when I'm at 3, 4, maybe 4 or 5 years in, I probably have done something wrong. I haven't helped the business leaders get to that level of transformation where they can take it over. Because this has really got to be the operating model that they operate their businesses in. And if I haven't taken my talent and repopulated it into the businesses, I will have missed the mark as someone who's here to create change and drive change. That means I also have to get pretty good at understanding the business and being a good colleague, because hopefully when I'm ready to say, our line of business leaders now own the transformation themselves. They understand it. They have the talent to drive it, and they're off to the races. I'm without a chair unless I'm really good at some other things, and I get invited to sit somewhere else, which is what my goal is. Work myself out of a job.
Yeah, no, indeed. So how does that play into the employee experience? How do you work with traditional IT?
Oh yeah, no, we got a great partnership. And, and again, there's, when you think about IT operations and what needs to happen in order just to make this incredible machine run every single day, they've got a set of expertise that is without question needed, necessary, and will forever be here. When we partner, it's really around some key elements on making sure we can take things to scale, because our IT organization is incredible at driving day-to-day operational excellence at scale. And so when we want to take our products and services to market, we need their partnership, and they can make it bulletproof for us and ensure that people have access. Because as you move towards more and more digital tools, well, you can't afford downtime. There's no such thing as batch processing in the digital world, right? So you can't afford downtime. So they're important partners there. When you think about what we're trying to do in the cloud and establish a secure environment, and we have the extra level. Not only do you have personally identifiable information, or PII like we did in financial services, you have PHI, personal health information. So it's a really important element here that we get absolutely right all the time. And so close partnership with our experts in the enterprise security organization. And so there's all kinds of ways that we kind of hold hands and drive forward. And there are some places where they want us to take the lead and we go run on it, digital health and analytics being an example. And there are places that we just shouldn't get in the middle of, like running the business every single day.
So Humana is headquartered in Louisville, Kentucky, and you helped open Studio H in Boston. So can you tell me about that and why it's important to Humana's future?
Yeah, that's great. And I'm so thankful you asked about our team up in Boston. And Studio H, as I was joining the organization, we also announced the opening of Studio H. And, we had chosen Boston, and Boston was chosen before I arrived. But as I walked through the process, I was so excited about their choice. When you think about Boston and the incredible presence of, academic institutions, when you think about healthcare delivery, some of the best healthcare delivery organizations in the country reside in Boston. When you think about the health tech corridor that's been created in Boston, the life sciences that exist in Boston. It just, and the epicenter and the talent magnet that city really is. You combine all those things, and why shouldn't we have a presence there? We want to influence the future of healthcare in America. We want to be a part of the change, and this combination of incredible human beings leveraging digital tools to make our Americans' lives, simpler, easier, and better, and the cost of care less, far cheaper. So that was a perfect geography. And when we look at the talent, we've been able to ramp up talent there faster than we ever anticipated. And so as we were heading out the door for COVID, we opened Studio H officially in September of 2019. So almost a year ago, right about Labor Day, we opened our doors at the new location. And we had done some pre-hiring in some temporary locations, but by the time we kind of went to work at home in March of this year for purposes related to COVID-19, we were already up to close to 160 people on board and running. And the idea there, the core of that center is really around advanced analytics and digital product management, software engineers. But we also had a couple of partner groups up there to support us and work with us, as well as a new business venture that I won't talk about here, but that we are also launching. And the core of that team is between Louisville and Boston. So it's really exciting. And to say that our location in Boston is a talent magnet for superior talent is to, I can't emphasize enough what a wonderful place it's been for us.
Well, you mentioned, AI or augmented intelligence and machine learning and NLP. I mean, it seems like you all are working on a ton of different types of, products and projects and initiatives. But, obviously scaling those is tough. Talent around those is tough. So I was going to ask you around, first the talent side of things, like how are you attracting folks for those things? Because it's expensive and hard to get talent.
Great question. Let me start with the mission at Humana to serve our members and to improve health outcomes. The way that we go about it, the way that we operate and work, the culture of this company is second to none. I would say coming from a wonderful company like USAA, number one for me in my mind was working for a mission-oriented organization. And because USAA taught me just how important that can be in kind of your job fulfillment. Well, Humana is also mission-oriented and does amazing things to make sure that we're making healthcare more accessible and easier to use and improving those health outcomes more importantly. So one, the mission of this company is incredible. Two, you talk about the kind of work that we're trying to do in the digital health and analytics realm, and people are compelled by the mission, the opportunity to serve, and to do really incredible work that will actually impact lives. And so the mission orientation helps. If you also see our location in Boston, and we also have a sister location in Louisville, these are incredibly motivating workspaces. And you would think you just walked into the most hip tech company ever. People walk in, they're like, this is a healthcare company, right? And we were also very purposeful in the name Studio, and it's Studio _ and a little H. We want to be tied to Humana. We are part of Humana. We love our origins and who we are, but it's the next evolution of where we want to go in this digital space. So, leveraging the look of computer language to actually attract people in and to show this is the next iteration of how we deliver healthcare in America. So the combination of all those things, and got some pretty cool people we've hired too, it just makes it really compelling for talent. And so we actually have a backlog of folks who, resumes have piled up, people who want to join, and we don't necessarily have all the spots. And so we are in just an envious position where we have no shortage of talent. So it's pretty exciting. And so I also want to hit you with something here, Ian. When we talk about advanced analytics tools and something like natural language processing or NLP, why is that so important, and why would we be talking about it in healthcare? And I can't remember if I said it earlier or not, but 80%, it's estimated that 80% of clinical data is unstructured.
Wow.
And difficult or near impossible to analyze. So the importance, right? You take that. And so that's what's entered into the notes in the EHRs, the electronic health records. That's what's entered in on the papers that float around in between doctors, right? We can extract that now with these tools. Something that was unthinkable 5 years ago is absolutely what we can do on a day-to-day basis today. That is so powerful. And to access that type of data, that text is incredible. In addition, we take millions of phone calls every year, those voice prints, those bio prints, and what we could do to capture the context for why people are calling, what they're struggling with, what we should be doing differently. We have a scale of applying these analytical tools now, and combined with the power of compute with the cloud. This is so exciting. This is a really amazing place to be. And it's really motivating to think about what the impacts are that we could have.
Well, yeah, I mean, and then you combine that with things like, looking at search and all of that functionality. It's like, how many searches are there for like knee hurts, right? And those sort of things. Well,
Yep.
It's like that's helpful to a point, but it's like you said, actually getting in the call and having that two-way dialogue, right?
Yeah.
When you take things like publicly available, information or leveraging things like search to look at that information, it's not a dialogue, right? It's not someone asking a scale of 1 to 10, how much does it hurt? It's not, bringing the person down this road of self-discovery and that sort of thing. And I think that I totally agree. It's like to actually be, proactive rather than reactive is like a really exciting proposition. And that's what data mastery gives you, right? It's not saying that you can predict the future, but you can at least lean forward a little bit and say like, hey, because of reason X, Y, or Z.
Yes.
Now, obviously that's a double-edged sword in some cases, and we could go into that on a different episode. But from a technology perspective, to be able to leverage that information to provide better care is really it's like a 0 to 1 creation, right?
Yeah.
You're going from, no data to all of a sudden, millions and millions and millions of data points is pretty remarkable.
Well, and that's where we start to get into the importance of not only securing the data and ensuring the right levels of privacy, but also governing the data so that it stays at high quality. And then a whole other topic we could spend another hour talking about, right? How do we ensure bias doesn't creep into the algorithms that are sitting on top of that data,
Yep.
right? And create further disparities or inequities that just could be completely avoidable if we're really careful about how we design, human-centered design, our algorithms as well. And so I'm proud to say that we Humana just signed a pledge to say that we will do our best, absolute best, to make sure that we have ethics around our AI and how we apply it and how we govern it and manage it. And this is going to be a really important element for all of us companies as we move forward, right? Especially as we sit in the middle of a COVID-19 pandemic. And then you have the racial injustice that just has been such in the spotlight and really come to open a lot of our eyes as to what we can be doing differently to ensure that we eliminate inequity that leads to disparity. We got a lot of work to do, but we got to make sure that the human potential for human bias doesn't get translated into technology bias with AI that lets it creep in. So that's a really exciting frontier too.
Yeah, it's an absolutely great point because, if, 20 hospitals all have, transitioned to using iPads or some sort of mobile device to be able to record things on the go and, empower folks. And then, 3 others don't have that anymore. Now, one is getting a much richer data set than the other. And there's all sorts of things that can creep in.
Yep.
I will say, and it's, I totally agree. It's absolutely critical. And that's cool that you all, took that pledge. And I think that there is a lot of optimism around this because I think that part of the problem, and we've talked about this on, other episodes, is that bias comes without data. Like data is seeking truth, right? Data is the reality, right? And so if you're not trying to be transparent and to figure out what is the ground truth, then you're just not going to be able to get to real results and real change.
Totally agree. And the last thing I'd like to offer is, we don't expect that we Humana are going to do all of this on our own. We have incredible partnerships with big companies and small companies who are really leaning in with us to really help drive the change. And so it's really important that we focus on these new partnerships and really help bring them along. And so, having our partners also start taking these same AI pledges as an example to ensure that we're all working together to create the next evolution of healthcare in a way that makes sense, the way that our physicians can be engaged and feel empowered and to liberate them from the administrative burdens that we've put them under over time. There's just so many opportunities to really reshape this, and it'll be Humana plus key partners, and it's really exciting.
Let's get into our lightning round. These are lightning fast questions and answers. The lightning round is brought to you, as always, by the Salesforce Customer 360 platform, the #1 cloud platform for digital transformation of every experience. You can go to salesforce.com/platform to learn more. Lightning round questions. Heather, are you ready?
I'm terrible at lightning round, but I can't wait to try.
I firmly believe your answers have been great so far. The lightning round won't break you.
All right.
Number 1, what is the most fun app on your phone?
My Blink app, because I can listen to all of these books in short order and actually get like smart once a day. I love it. 15 minutes a day, I get smart. By the way, MLB app is my other favorite app, and it was dormant for so long that I'm so excited that baseball's back on TV. I just wish I were at the ballpark, but that's just a side note.
Favorite book, podcast, or thing that you've binged recently?
My favorite podcast of late has been the Wall Street Journal, the summary that you get at the end of every day. It has been just such a lovely reprieve to kind of just listen and to absorb as I'm walking, because I've been taking daily walks since COVID started. So that's been my favorite binge effort.
Do you have a habit you picked up in shelter in place?
Yeah, but I probably shouldn't talk about that. I probably drink a little more wine than I normally would. So we'll put that off to the side. But I would say actually going for these daily walks has just been like a life changer for me. And people being flexible. If you're taking a walk, even in the middle of the day, you need a break, and people are happy to have you do it because they want the same permission to take a break. So it's been awesome.
If you weren't doing this, if you weren't a technology leader and business leader, what do you think you'd be doing?
All right. I want to tell you what my favorite job ever was, and it will remain till the day I leave this world. I loved running contact centers. It is my favorite. I loved call arrival patterns. I loved talking to customers. I loved the people who took care of customers. It was the most inspiring, jaw-dropping experience of my entire career, and it's where I learned more in a few year period than I've learned in all my 25 plus years. So I would go back to it because I love it. I'm a geek.
Who's your baseball team?
Washington Nationals.
What question do you never get asked that you wish you were asked more often?
I don't know. I see, you stumped me. You got me. I don't know. That is a weird question. So here's the problem with me is if you ask me a question, I will answer. And so it's a hard thing because people will tell me I'm too transparent and I should probably hide things a little bit more, or maybe not be so honest about because I will just tell you exactly how I feel, exactly where my head is, and it freaks people out. How about that?
I'd see if I had known that at the beginning, the questions would have been different. Okay. Final thing. What's your best advice for a first-time head of technology and analytics?
Care deeply about the customer. Don't forget about the end user, the end person you're serving. Forget about end user, the end person you're serving. It's so easy to get wrapped up in tech for tech's sake. It's not. It's to enable some great outcome that your company is looking to deliver. And just don't ever lose sight of that, and spend time every day listening to the customer in some way, shape, or form. And it will be very difficult to go wrong if you have that true north.
Well, Heather, this has been wonderful. Thanks so much for joining. And any final thoughts? Anything to plug?
Ian, I want to thank you for the invitation to the show. This is a fantastic format, and really appreciate what you're doing to get people's stories out and companies' stories out, and to talk about transformation. I think it's really powerful, and it's helpful because sometimes we can all feel a little bit lonely and that we just aren't sure we're on the right path, and to kind of get validation through the stories that you allow people to tell, I think is really valuable. So thank you.
Well, thank you. And we'll be following along. So we really appreciate you coming on.
Thanks, Ian.
IT Visionaries is created by the team at mission.org and brought to you by the Salesforce Customer 360 platform, the #1 cloud platform for digital transformation of every experience. Build connected experience, empower every employee, and deliver continuous innovation with the customer at the center of everything you do. Learn more at salesforce.com/platform.